So my name is Hillary Pullins. I'm one of the two nurse practitioners, one of the three providers in at the Dayton Offsite Clinic. So I am here on Wednesday, Thursday, Friday, and Tanya works opposite of me on Monday, or sorry, Tuesday, Wednesday, Thursday. I think I just told you I was here on Friday, not coming on Friday. Monday and
What?
Friday is Tanya. So I am
City of Dayton.
one of the mid-level providers.
Yeah, come on over if you want to. Oh,
So I'm one of the mid-level providers at the clinic. I've been with the company for 7 years, but I've been at the Dayton clinic since 2020. So I definitely am recognizing a lot of names here. So I know that I have seen a good amount of you, and some of you I have a pretty good running relationship with. So I'm excited that you guys joined today. So, when it comes to sleep, some providers in practice will actually coin this as a pillar of health, meaning these are one of the foundational skills that if we don't have this um, optimized, then there are many, many downstream effects to that. So, when I speak with patients, especially during yearly physicals, oftentimes we will get talking about whatever issue they have, and it will come back to the sleep cycle issue. And as much as some people don't want to address it, truly addressing this foundational issue can solve many, many disease processes. So, when it comes to sleep, um, it is imperative that we go through the various cycles. You may or may not remember from science class. I won't bore you with all those details. We'll hit the high points here. But when when we are not sleeping, it doesn't allow our body to recover. At night, when we are in that rest and digest phase, we are supposed to be sending in all of the cellular cleanup to, keep our inflammation markers down, to keep cellular debris at bay, to keep. It's very imperative in blood sugar regulation. There's many different factors, but some people don't realize that it's more than just waking up cheery. Truly, biologically, it is the time that our brain requires to recover. It helps with our memory and being able to intake information and retain that information. It, of course, is imperative for our mental and physical performance throughout the day. Of course, it improves concentration. So, a lot of people will identify with some of these things, but some of the things that people don't identify with and they come and speak with me about that I hear as kind of repetitive things are hormone health. So, oftentimes, impaired sleep is a sign that our hormone health is not optimized. And of course, that can be a little bit of a challenge because it's not a quick fix, but a lot of people don't even connect that as a possibility. So, when we are not sleeping, we directly affect our hormones. So then we'll start having hormonal symptoms. So, to be more precise, I apologize, I don't have a presentation ready with all of the data sourced, but um, they have shown statistics where just having impaired sleep can decrease testosterone levels within just a matter of 5 days. Now, of course, the good thing is if we correct that in due time, that our body is can facilitate recovering as well and healing. But a lot of people don't realize that there's such a close correlation with that. Blood sugar, we kind of hit on that a little bit. That's another one that oftentimes people aren't aware of the importance of the blood sugar insulin response um, and how that whole cycle fits in and why optimal sleep is imperative for that. One that a lot of people will ask about or maybe quickly inquire or make comment to is weight maintenance. And a lot of people don't realize that optimal sleep is necessary for metabolic health. So that's your weight loss, your weight maintenance. So if you sign up for certain weight loss programs, whether it's macro counting or you're trying to reach a specific goal with building muscle or whatnot. Many of these programs will put in there, or if you're using an app, they will put in there that sleep piece, and that's because our ineffective and suboptimal sleep directly affects the way our body can handle metabolism and weight loss. So many times a coach might meet and they might give you, again, referring to like the macro counting, they may give you calories and macros, and people keep hitting walls and they'll say, well, tell me how much you're sleeping. And it's because it is directly related, and gives many clues about the blood sugar, the insulin, and hormone health. And those are all tightly interrelated. So a lot of people do not realize just how imperative that is. The other thing would be any kind of neurologic function or disorder. So your depression, your anxiety, any of those mental health factors it is imperative again for us to have optimal sleep, because if we do not, then our body is not ebbing and flowing through those neurochemicals the way that we are designed to perform. So that's why sometimes, depending on what is going on, for some people, they actually will need those types of medicines to try to regulate a normal rhythm of sleep. So, our ideal goal for sleep should be 7 to 9 hours a night. Studies will kind of vary on that, but 7 to 9 hours is kind of the widely accepted rule here in the United States. Um, One of the things that we should be checking in with is if you're getting 7 to 9 hours and you're waking up and not feeling refreshed, if you are really slow to start or you are really dependent upon a caffeine or stimulant aid, then that should signal that we have poor sleep quality. And then we should start looking into what are factors that create poor sleep quality, right? So a lot of these are checks and balances. Our sleep should be kind of like a grade card as to how our overall health is doing. Um, so some of the signs that we're not sleeping appropriate, other than waking up and feeling exhausted. Maybe you get up and you get going, but you could fall asleep driving. If especially if no one else is in the car, maybe you could sit down and read a paper or watch some TV and fall asleep during that. Um, Perhaps you feel like you need to take a nap daily, or you do take naps daily. Perhaps you have difficulty with mental clarity, difficulty concentrating. All of those different things can let us know that our sleep quality is poor. Now, on the clinic side, if we're having those things being reported, then one of the things that we are going to want to screen and refer to is potentially a sleep apnea testing and evaluation. We know that sleep apnea is truly very common, um, but just because it's common does not mean it's normal by any means. And when we are not oxygenating the body appropriately during sleep, then all of that repair and recovery is not happening. Um, we are not cycling through all the sleep cycles the way that we need to, which causes all kinds of downstream dysfunction. One of probably the most prevalent, and the one that most people maybe know and identify, is high blood pressure. They know that there is a very, very strong correlation between blood pressure, cardiac health, and sleep. In fact, there's some pretty interesting studies, and again, I apologize that I don't have the research articles to share with you, but there's some pretty interesting studies where they actually have studied the daylight savings time and hospitals and the cardiac events. And what they show is that that hour of springing forward and losing that hour of sleep increases cardiac events in just that 24-hour period by 25%. And yet, the fall, when we get the extra hour of sleep, it decreases the amount of cardiac events within that 24 hours of of gaining an hour by 21%, which, that is, we can't change the time. So really buffering around those times is super important. But that's just a little glimpse as to why it's so important and how these chronic uh, chronic disorders that you may be coming to the clinic to be seen have these foundational roots. So oftentimes people, they come and they want a quick solution. And we talk about diet, we talk about exercise, we talk about sleep, we talk about stress management. And albeit I know it's frustrating and sometimes it's more difficult, but it is the true key to health, is proper sleep. So um, let's talk about. I guess let me open up to a couple questions before we talk about how we can fix some of these things. Is there anything specific anybody wants to know before I get into um, some things that we can do to optimize our health, or sorry, optimize our sleep? All right, we will move
My
on.
biggest
So,
question, Hillary, was
mhm.
just to try to figure out how I can get more sleep. I tried everything under the sun, including medication, and it's not working. I've done the melatonin, the meditation, everything else, reading books. I'll get sleepy, but then I can fall asleep, but I can't stay asleep.
So the first things that, and they seem like sort of boring and bland, right? Because we do want that really fast type of fix, but we really want a good solid foundation before we jump into some of those medications. Yes, there are medications available, and by all means they do have to be used by people at times, but it's certainly not a pathway that you want to go down first. The reason being, we know with any medication, um, when we turn on or turn off some kind of function, then there are downstream effects, right? So by all means, they have their place, and we that's what that informed consent and going through risk benefit ratios and whatnot is all about. But when it comes to sleep, oftentimes people feel that maybe they've exhausted every opportunity because they've done melatonin or they've maybe taken other sleep aids, Tylenol PM and whatnot, and sometimes those things do need to be taken. But truly, the fundamentals that need to be reached and have time and time again helped people who have you know insomnia, clinical insomnia, not just thinking, but they have shown clinical insomnia through sleep centers. They work with cognitive behavioral therapists, and it's all about creating the environment and creating the routine. Okay, our bodies are very cyclical. That's where the circadian rhythm comes from. That is directly correlated with sleep. If you work with a sleep specialist, oftentimes what they will do is they will run a couple different hormones on you to see if you are in that cycle and where you're at with that. And then they offer these foundations first before they ever go to the controlled sleep medications. So, probably one of the first things that should be done, and honestly, one of the most difficult, is establishing a sleep routine. So, really trying to look at, for me, I have a family, so I get how difficult this is. Having young kids, lots of school activities, working, commuting, running businesses, but trying to stick to a pretty routine schedule. So, for instance, again, I guess I'll use myself as an example. In the summer, we are a 10:30 to 11 o'clock family going to sleep. And and then we are looking at waking up at that like 6 to 7 o'clock hour. Of course, a little bit earlier for my work days, but that's what we're looking at. Now that we're falling into school, getting darker earlier, we're getting up to bed, normally about 9 to 10 o'clock, and getting up earlier, of course, as well. So, really trying to set that tone around that. You're not going to be perfect all of the time, but shoot for perfection. And if you fall short, you're still going to have accomplished quite a bit of a goal. So, really looking at what that looks like for you and trying to stay consistent with that. Some of the things that need to be taken into consideration with these routines is that light and dark. So, really making sure that your bedroom is very dark. That can be the blackout curtains, any kind of surrounding lights, definitely not TVs. I know that many people like to fall asleep with TVs and they don't think that it bothers them, but there are just hundreds and hundreds of studies that prove otherwise, that it is that detrimental to us. Our body is so light reactive. So, really dark atmosphere. Also, when we wake up, exposing ourselves to natural daylight. So, trying to, even if you can only step outside for a couple minutes before you get into your morning routine, if there's some daylight, trying to get some of that first daylight, because those rays are very important for setting your circadian rhythm. Again, there are some providers who, when they do sleep training with people, they will, have the people look at, okay, what time is the sun going to rise? Because they will have the patients go out and look at that first sun for a couple of minutes within the first hour of the sun rising, because it's that important to our circadian rhythm. And the claim is that just having patients do that for 2 weeks routinely, having this routine set, that they are able to reset a large percentage of patients with just that intervention. The other things to think about are surrounding sounds. So, if you need an earplug, if you need a white noise machine, something like that can be beneficial. The other thing to consider, if you're a parent and you need to be able to hear, I have not used them. Admittedly, um, I sleep well, but I think it's from having sleep deprivation for 5 pregnancies in the last decade. But I speak with many patients and moms that use the loop earplugs, and they will just deafen the sound, but you can still hear the sound around you. So that decreases some of that response. So that can be very helpful as well. Um, Other big things that people, you know, tend to maybe not do really well is eating and drinking around sleep. So it's not popular for people, but truly trying to stop eating 2 to 3 times before bedtime is very, very imperative. And the reason being, when we go to sleep and go into that rest and digest, we want that that blood flow and that oxygenation should be nourishing our whole neurologic system in our brain, because that's where all of our signaling comes from. When we are eating prior to, then we are sending all of that workforce to digest food, whether we're still eating, obviously, or not. It has to digest for hours, and some people are different than others, but that is where we start seeing issues with blood sugar regulation, um, deep sleep, the ability to reach deep sleep. So some people will say, well, I actually like to eat because that full belly makes me fall asleep quicker. But again, we're not reaching our cycles the way that we should. So people actually do not achieve deep REM sleep when they eat too closely to bedtime. So you may fall asleep, you may stay asleep, but your sleep patterning is not appropriate. The other thing, again, is the drinking, and drinking in particular is the drinking of alcohol. Again, this is one that is not super popular and can be very confusing to people because, people feel like, well, actually, when I drink a nightcap, that's what helps me go to sleep. And again, you may be able to initiate sleep, you may be staying asleep, but if you had monitors on your brain waves, it would show that your sleep response is not appropriate and optimized for full recovery and functionality. So a lot of people will not feel well, and that's also the way that alcohol interacts. It also can really mess with the chemicals in our stomach, the hormones in our stomach. So leptin and ghrelin, and it can really cause satiation issues in the upcoming days. We can have a hard time feeling full, and then there's where we start spinning into that weight gain and metabolism issue is all intertwined with that alcohol consumption, even if it's just one serving before bed. So when it comes to food and alcohol, we should be looking at 2 to 3 hours. And actually, most studies show that alcohol should be closer to 6 to 8 hours prior to sleep. And then on the opposite side of that, the stimulants such as coffee and caffeine should be reserved for, and the studies will vary, but anywhere from 6 to 10 hours. So kind of go down the middle, and definitely 8 hours before your optimal bedtime. You want to be done having any caffeine. Again, even if you can initiate sleep and stay asleep biologically in your cellular function, it is not optimized. You are not getting the most out of your body and your metabolism if you're not doing those things. And again, this isn't to say that you can't ever do these things, but we need to be very cognizant of it. And if you are interested in how you are sleeping, there are some wearables now that have given just loads and loads of data um, since even before COVID. But one of the things that we've learned a lot about for years is sleep optimization. So some of those devices are like the Aura rings, the Whoop watches, and they will let you know how your sleep was and how that score relates to your recovery and response. So that for some people is what they need to see. They need to see, because maybe they feel like they're sleeping well, or they know it's poor, but they don't know the degree to which it's poor. So you can kind of plug in some of those behaviors and see how your body responds to it, right? Other things that we need to uncover and try are things like, decreasing screen time. Um, we know that blue light from screens can really cause issues with being able to get to sleep. So, ideally, cutting that off a couple hours before bed, but at absolute minimum, using some blue blocker glasses in the evening after dinner time if you're going to be on any kind of screen, TV screen, laptops, iPads, iPhones, or I guess I'm not plugging Apple here, but any of those types of devices. Um, excuse me. So we need to consider decreasing that blue light stimulus. The other thing that's really, really important for sleep is temperature health. And um, there is a lot being done in this area right now as well. But it makes sense why um, some people will say, man, I feel great and I can sleep really well after a nice hot bath. And that's because our body, to get to sleep, our core temperature has to drop by 1 degree Celsius before we can initiate sleep. So what happens is when we take a nice hot shower, we bring all that heat to the surface away from the core. Then we go and lay down. It actually cools us at the core quicker because we've pulled all of that heat to the top of our vascular system, to our hands, our feet, and whatnot. So that's very, very important, and that can get us to a better sleep state prior to even getting straight into bed. So considering something like that, that's why sleeping in a cool room is really, really important, because again, when we sleep in a cool atmosphere, it's going to pull all that heat to the surface to try to warm our body, but it's cooling our core, which is necessary to initiate the sleep cycle. It's our body's signal saying, okay, we're ready to go in and do that rest and digest and recovery. So it has to be signaled that way. That's where a lot of people, again, may not realize that one of the signs of hormonal health is difficulty sleeping. Perhaps they're not having hot flashes. Perhaps they're not having, odd things go on with their menstrual cycle, but they just cannot sleep. Then they start looking in on their hormone health, and it's found that their hormones are imbalanced, and then they get a little bit of hormone supplementation, and boom, they're like, oh my gosh, I can sleep. Who knew? So that all has to do with the way we can thermoregulate um, and optimize that. So when we get into bed, after we've tried to decrease our core temp some and keep our environment nice and dark, the other big things are don't do anything in bed aside from sleep or sex, right? Bed should not be affiliated with work, with socialization, with endless scrolling. When we endless scroll, we're actually trying to oftentimes ease our nervous system. We don't want to do it in that way in our bed. If you're going to do that, if you're going to check emails, if you have just got to check something out real quick, you've got to, you're in a little bit of conversation with somebody, you truly need to get up and get out of bed and do it, whether it's in a chair in a corner or, standing in a ensuite bathroom, you've got a desk in the room, whatever the case may be, but you don't want to do it to the bed because our brains are incredibly smart and adaptive. So if we are teaching it that um, we associate the bed with these other things, then it has a harder time turning off. So we want to signal, hey, when we go to bed, it means sleep. So that's why, again, when people go through sleep coaching, they'll be taught about, the types of things to keep in the bedroom, especially kids. Kids are a big one, decreasing, like really not keeping toys in bedrooms, really keeping bedrooms a little bit bland and boring, like personalized, but not too much activity and interaction, not doing disciplines in bed, not doing homework in bed, those different types of things, truly getting up and out of that situation. So college students, when my daughter went to college and started with her dorm, the dorm was so small. I said, whatever you do, make sure that you go downstairs to a study room or you go to one of the libraries, and that's where you do the majority of all of your studying. Because you do not want to start teaching your brain that that's what you're going to be doing in bed. Bed should be signaling sleep. Okay, so very important as well. Now, so let's talk about. Um, I'll brush on a little bit of supplementation again, basically because this has to be individualized. We really need to see what all has happened and what things to consider. But one of the easiest things to recommend, because it is so overarching for most every American, is magnesium deficiency. So magnesium has hundreds of jobs in the body to take care of, and we utilize it every day. And the more we have activity and stress response, the more we burn through. Now, when we talk about stress response, some people think even, like an actual stress of work or family, like big traumatic event. But truly, it's anything. It can be over exercising, it can be under eating. Um, these things can happen with many things. It can be scrolling and comparing, and there's many different things that can cause stress without it being big traumatic events. Our body's being stressed every day. Perhaps maybe you work in an environment where you are in a big temperature. adjustment. You're working outside, so when it's cold, you're really, really cold. When it's warm, you're really, really hot. That's a stress to the body, right? Um, Not all stresses are bad, but that means that we need to support that stress response to keep it healthy, because we want to be able to go in and out of that fight or flight stress response. Magnesium helps us do that. It's one of the minerals that can help us do that. So one of the very first recommendations I always give everyone, because it helps so many different things, is a magnesium supplementation. The one that I most typically recommend, just because it's very, very easy to find and it's affordable, is Magnesium Calm, and it comes in a powder or a gummy. Taking that at night on an empty stomach. Now, this is not going to react like a Benadryl, a Tylenol PM, a melatonin, any of those types of things. Now, I do have a small subset of patients where it will do that because they were so magnesium deficient. But for the majority of patients, it doesn't work quickly. It's more of a filling of a bucket, and we don't know where that bucket starts because this isn't something that we're screening. So, looking into a magnesium glycinate or a magnesium threonate, those are two that are known to calm the nervous system and to help improve sleep. So there's many, many products that you can find that tick off those boxes. Um, Melatonin is, of course, one that I get asked a lot of questions about, and melatonin can be used. It's just like anything else. That's not a supplement. Magnesium is an actual vitamin and mineral that we need. Okay, it should be coming from our foods. If we eat foods, we shouldn't be getting melatonin, right? So when we supplement these, which melatonin is actually a hormone, so when we supplement these, we have to again realize that there's downstream effects, and that doesn't mean that you can't use them. It just means if you don't need them, don't use them, right? And using them correctly. So the biggest talking point I go over with patients with melatonin when they say, melatonin just is not working, is number one, have you been using it for a long period of time? You may need to start and reinitiate, titrate back up, because you perhaps are becoming a little bit uh, too, sorry. It's funny that I'm doing this sleep conversation because I had the least amount of sleep last night that I've had in many, many months. But we you are reaching your threshold, so you've got to back off and then reintroduce. But the biggest thing that I find with melatonin use is a lot of people haven't been instructed on melatonin. So when we use melatonin, we should be using it right before we go to bed. So the reason being is if we have a chewable, a gummy, a liquid, whatever the case is, we truly need to, be at our bathroom sink or be doing the final, couple minutes before bed, taking it, brushing our teeth, and then going and laying down in the dark room. The reason being is because melatonin is activated and deactivated in our eye. So that's our body's signal to know, hey, it's dark, it's safe, it's time to sleep. So if you are taking melatonin and then looking on your cell phone or watching TV or doing something else that has light involved, then you will deactivate it. So when you deactivate it, it's either A, not going to work, or for some subset of the population, it actually does the opposite, which is it gives you more energy. Okay, so we don't want to do that. So really using melatonin appropriately before we say we've done all these things and nothing's working. We've got to rework the basics before we start jumping on board to some of um, these bigger medicines, and mainly because most of these medicines are controlled and are habit forming, and they actually, albeit necessary for some people, severe insomniacs truly do need it, but they've went through specialists, sleep training, done many different therapeutics, but they do show that they are not getting that that deep REM sleep. So we know that over time, of course, they're still going to struggle with health ailments, even if they feel like they're getting sleep. That's why some people will take these and then they're still just so groggy in the morning. And that's because it actually didn't allow them to get that deep sleep. So they didn't get that deep oxygenated sleep cycle in their brain. So they've got to spend some time getting really, really oxygenated to get going in the morning. That's what's actually causing them to be groggy. It's not leftover medication necessarily, unless they didn't have much time from the time that they took it. So okay, I feel like I've said a lot. Um, Questions about you know specifics or something that I had said or anything else? Oh, sorry, I'm seeing that there's a question. Let's see if I can figure this out. Notes.
Hear me now.
I heard somebody say, "Can you hear me now?" But then I don't hear them again.
Yes,
There's a chat.
check the chat and then realize it's raised.
Is that Sarah? I
Uh-oh,
can't hear.
Sarah, you're breaking up again really bad. Um, I can go through that. Can you hear me okay, Hillary?
Yes.
Okay. As the first person said, aside from the things that you suggested here, what do you do about touch deprivation causing sleep disruption either at the start or middle of the sleep cycle?
Touch deprivation. I mean, I can assimilate what that maybe means, but I don't have a well versed answer on that. Um, I'm assuming if you have a specific question about a touch deprivation, then you would have talked with an actual sleep specialist because that's definitely over the primary care role.
And then we have another one that says with magnesium calm, is it a different type of magnesium than the kind that makes you go to the bathroom?
Yeah, the kind that makes you go to the bathroom is magnesium citrate. Now, I will say, even with the magnesium calm, for some people, especially the glycinate, three or threonine, some of these do optimize bowel movements, but they do not cleanse like the magnesium citrate. So yes, that's part of the reason that I use the product Calm, not because it's the most superior product. It's an appropriate type of magnesium, and it's a word that people can remember, because one of my worries is a patient's going to go and just think magnesium, and then they're going to grab the one that causes cleansing of the bowel. So yes, that is different than the magnesium citrate. However, I will say that some of these magnesium forms do help with regularity and bowel movement. So if you have a very sensitive bowel, then it could potentiate more bowel movements. But most of the time, when people have that, it's they take it before bed, and then when they wake up, they have a bowel movement in the morning, and then it resolves throughout the day. So, Jamila, I will go back to that touch deprivation thing. I'm
Mm-hmm.
not sure if this is speaking on the same level of, but I do know with some children, they will need a sensory response because we should be going through a stage in our sleep where we have a prior perception differentiation. So what that means is, like, some people will identify this as like um, the sense of like a weightlessness, like when you fall asleep and you know that you're asleep, but you're like you might be woke up quickly um, out of a sleep because it's super light. Some people will have the sensation of like falling or flying or this weightlessness, and that's the body's relationship with that perception in the neurologic system at the early stages of sleep. So for some people who have sensory issues, and there's more work coming across with this with children, uh, they will suggest doing weighted blankets, and or there are like nap pods that kind of wrap. They're kind of like a snug, thin sleeping bag, like a cocoon, where you'll kind of cocoon in, and that allows just that light, constant pressure to help with that proprioception regulation throughout sleep. So I don't know if that is touching on what you're asking about the touch deprivation, because I'm not familiar with that, but I do know with sensory and the proprioception, that's something. So I'm not sure if those overlap.
Do we have any other questions? You can unmute yourself or put it in the chat box.
So I guess I'll plug a couple of things. Um, of course, yes, we can walk through at the dock. We can walk through what's individualized and try to, walk through some of these things with you. But we do have some tools. We do have some very first line types of medications. We don't carry the big gun controlled medications, but we do carry some first line stuff to kind of help people. We typically will use those more in situational rather than chronic issues, because they haven't been shown to give good results over long periods of times, or maybe they haven't been researched for long periods of time. But we do have a couple of those tools in our dispensary at this time that we do utilize with patients. The other thing is, if we get back to, having the sleepiness during the day and some of those signs and signals that we're not getting good sleep, then uh, we do also help assist people with getting them sleep apnea testing or sleep apnea referrals to help with that. We certainly can also, even if the sleep apnea is not the issue, you can also consider, if you have insomnia or you've been battling this, and you've really exhausted all of these different methods, we can also assist in getting you a referral for a sleep specialist. There's many sleep specialists in the area that they can, help you with a more in-depth testing to identify your needs, or maybe even a closer guidance with some of the medications that are controlled.
Hi, Hillary. My name's Eric Myers, and I had one question and then one, I guess, piece of information to share with the group. On the magnesium, I recently was put on it by my physician, but when I went to the pharmacy, I have another medication I take that I guess conflicts with it. So, and I take that medication multiple times a day. And I know you were saying about taking it towards night. They were
Mm-hmm.
telling me to take it at least 2 hours apart. So if
Mm-hmm.
I can't, one of the medications I've been on for a while, I do take in the morning and right before I go to bed. So I guess I'm trying to debate on how I should take that magnesium.
Yeah, so the magnesium, for some people with some of the medicines, it may block it and
Mm,
decrease its ability to help. So that is one of the reasons that we will separate it. There is a common morning medicine that has to be taken a couple hours, and that's to protect the absorption of that medicine and make sure that it is optimized. It's not just on the magnesium side. So, if you, how soon before bed do you take the other medication? Like right
usually
before bed?
between, yeah, usually between 7 and 8 o'clock because I go to bed around 9:15 to 9:30.
So you take that other medication about 2 hours before bed?
Yeah,
If you're
probably.
taking your prescription medication and it's got to be a 2 hour gap, then you could take that magnesium right before. If I was going to say, if
Okay.
you're actually taking it right before bed, um, because of its working throughout the night, then the magnesium can be taken, and earlier in the day. Now, with the
Okay.
calm, there's two different types. There's a calm that is sleep, so calm sleep, and that has melatonin in it. So of course you wouldn't want to take that one midday, but if you took the regular calm supplementation or did a couple of those gummies, it's not going to cause you to necessarily be sleepy like a Benadryl, a Tylenol, or anything like that. So you could take that earlier in the day, and just take that as supplementation, or along with snack. Now, do be advised, of course, if you are someone who has regular bowels and stuff, and your body is sensitive to it, then there is the possibility you may have a bowel movement. I don't know if that matters for your job or not, but I know that I have a lot of work site people that they're like, I cannot have a bowel movement at work. So so it's one of those try on the weekends type of thing to see if it's something that you take, and then within an hour or two you're having a bowel movement. Very rarely is it diarrhea, but I can't say I've never had that reported. But very rarely is it ever that. It's just it causes to have a bowel movement.
The thing I wanted to share with everybody, just I've really battled some of my health issues over the last few years and gone to many, many specialists. And come to find out, I did have not only sleep apnea, I have central apnea. So I don't know how many people understand that there's more than just one type of apnea out there, which I would have never known. But I ended up having to go through an at-home study to in the lab studies to even get put on the correct machine. And it took me not 8 or 9 months to get through all that. So
Yes.
You have to exercise patience as you go through that whole process, because these sleep doctors are very, very busy.
Yeah. And it's difficult because sleep is related to so many different variables. I mean, it can be your stress response, it can be the way you caffeinate, it can be the way you oxygenate in your example. It can again be the blood sugar regulation, and when we get into blood sugar regulation, I mean, boy, that's unveiling a whole journey too. So, I mean, that's one of the things that I personally believe, that all of health is a journey, and to try to embrace it as such, but know that when these things are off, it is signaling us that there's more to unravel with this. It's just the way it's going to be, because if we don't take care of this and really prioritize it, so many of these chronic diseases that are downstream are caused, and you may come across doctors who will never say, because they just don't have the time. It's just as you said, when we get into some of these specialty medicine providers, they have a very small amount of time to educate. So oftentimes people aren't told, yeah, your sleep apnea has been the root of your blood pressure. Now that you have your sleep apnea optimized, all of a sudden they're coming to me and saying, well, my blood pressure is getting low. Should I need these blood pressure medications? And when we start talking about this, then we find, oh, it's because you actually have, went through months, got your mask fitted, and now you're having a utilization over 75%, and you're actually sleeping great. And some people don't put those things together, because some people that have apnea actually didn't sleep terrible before. But maybe they just woke up really groggy, or a significant other said, hey, what you're doing at night is really scaring me, get in and get that checked out. So did you have any local sleep people that you really liked?
Well, I'm from the Westchester area, so I worked with UC Health and
Okay.
used their facilities. And everybody that I've worked with so far has been really good. It's just, I wish we could condense and shorten the time, and I could have got through it much quicker. I think it's very challenging on the back end once you need to get your equipment. I found out not all of those supply companies are very responsive. So even the one I'm using now, I just don't like how they do some of their processes and procedures.
Yes.
It's
Some of them are
it's
very painful.
cumbersome.
Yes,
Yeah.
some of them are very painful. That is truthful. The other thing that's difficult about apnea and that journey is, it's not just about the equipment and having the equipment, then it's how that equipment hits your anatomy. So, you
Mm.
know, that's another thing that, again, people don't think about when it comes to this sleep is how our anatomy impedes sleep. So, if you're, if you have um, a narrow palate, or your teeth are not aligning and your tongue is not laying correctly, all of these things matter. So sometimes you may venture down with a sleep specialist and they may say, I need you to talk with this orthodontist who does sleep work as well, because we need to actually align, because even if you have these machines on, you're not getting enough oxygen to you because of your malalignment in your mouth. Weighted blanket sounds like it's beyond basics. So yeah, definitely a specialist, and I would say not just any specialist. You would want to speak with someone who really uses more of the cognitive behavioral type aspects, not just a lot of your sleep medicine docs are going to use just apnea equipment and medications. But there is sleep docs who have either someone on staff, or they are trained and certified with the cognitive behavioral sleep aspect of sleep.
We have like 1 or 2 more minutes that we can probably get a one question in if anybody else has one. Does anybody else have any other questions? Okay. Well, thank you, Hillary, so much for your time. We definitely appreciate all these tips on sleep health.